Can testosterone save your sex life in menopause? I want to talk about in this video, what is the role of testosterone in low libido? A lot of women experience just lack of interest, lack of arousal, lack of desire. I commonly am asked, does testosterone help? So in this video, I want to talk about low libido or hypoactive sexual desire disorder. What is the role of testosterone? Can it help you spice up your sex life? If you're interested in this, stick around. Okay, ladies, let's talk about this. So first of all, I want to talk about what low libido is, maybe what your reference ranges would be for labs, and why you should consider testosterone to spice up your sex life. So low libido by definition just means that you really have lack of arousal or desire, or really lack of interest in sex for 6 months or greater. And it's really, really common. In fact, most women experience low libido in perimenopause. They start noticing that because the decline in both estrogen and testosterone affects your sex drive. So how do you know if you were just to test your testosterone, which I actually do suggest? You can't really tell testosterone levels from like a cycle if you're having regular cycles. So the only way you can really do that is to get it tested. So what I suggest is getting both a free testosterone and a total testosterone. And the reference ranges, when you look like, say at Quest reference ranges, it'll say 2 to 48 for total and 0.5 to 2.5 for free. I actually tend to focus on a total testosterone that's above 30, but no more than 100. And a free testosterone somewhere about 1.5 to 2.5. That's where I find that most patients do well and don't feel symptomatic. They don't have symptoms of low testosterone. And low testosterone symptoms can be things like low energy, brain fog, joint pain, low libido, and low libido meaning lack of arousal or desire, even like a lack of sensation. When you lose testosterone, then you sometimes kind of get this feeling like you're dead inside. Like, I mean, I don't mean to be sort of graphic, but it really is that sort of feeling like things are like numb down there. They're not working like they used to. And so testosterone does so many things. So let's first talk about testosterone's benefits that are non-sex related, and then add in why it's beneficial for your sex life. So first of all, testosterone is critical for the brain, for your bones, for your muscles, for your heart. And so those things actually do change when you start going through perimenopause. Menopause, women will say, gosh, I'm getting brain fog. My energy is zapped, even though my vitamin levels look normal. I'm losing muscle mass. I go to the gym and yet I can't seem to hold on to muscle. It seems like it turns into fat instead of muscle. Testosterone can benefit that tremendously. You can actually get a lot of benefits from using testosterone for just those things, but for libido specifically, it improves blood flow to the genitalia. So it kind of awakens the genitalia. So when you take testosterone, most women will notice they feel like they have those sensations. It was very easy to get aroused. It was very easy to get desire like you did when you were in your 20s. And certainly if they're able to achieve orgasms more with testosterone, and actually even testosterone can be used in the vagina. You can actually use both topical, but also they have DHEA suppositories because there are androgen receptors in the vagina, both estrogen and androgen receptors. So there are women who use it in different forms. That's actually something we should talk about next, about the forms of testosterone. So testosterone in women, there is no FDA approved testosterone. In fact, that would be like a goal of mine before I retire, that they come up with an FDA approved testosterone, because I think it's so valuable. In other countries, they actually sell a patch, which is also has great clinical data behind it. But here in the United States, we've never been able to get it passed, or at least pharmaceutical companies have not been able to get a patent for testosterone. So testosterone, you can use the FDA-approved testosterone for males. It could be Testosterone, Androgel, whatever form you wanted to use. You would need to typically take about 1/10 of that dose. So it comes in packets. You can measure that out to be about 1/10. There are ways to do it with those FDA-approved products, but I would tell you that I do sometimes find that pharmacies will not give it to women. And so you may need to check to see if you can even get it, because personally, where we live in Southern California, Walmart refuses to give women testosterone, even if I write the prescription. So shame on you, Walmart, but that's true. So the other options which I prefer is to use compounding. So when you use compounding, they literally make the dose for you. So when you do one click, for example, so I actually haven't done it today, so it's just one click, it's just cream. So for me, this is 4 milligrams of testosterone. It can be any dose that actually works for you. It could be 1 milligram, 2 milligram. It's really personalized, which I prefer. And that way we know that we have good levels when we actually check blood work, that we're staying in a safe zone. So testosterone can be put into a cream form, and this cream can be used in the vagina, or it could be used on your wrists or your arm or your thigh or your calf, wherever. I don't have small children, so I'm not concerned that a small child will hug me and I will get testosterone on them, so I just do it on my wrist. And you can also use testosterone in both injectable form and pellets. I'm not a big fan of those other two for women because those doses tend to be really, really high, and I find that I just don't need it. I mean, I typically range for my patients between, like, say 2 and 10 milligrams, depending on what their dosing and their levels show. But most people are like on 2 to 4 milligrams on average. I usually stick with the cream form and not the injectable and pellets. And the other thing that testosterone does specifically for sex life, besides, improving blood flow to the genitalia, but also it helps in the brain level too, for that, reward center that says, like, yes, sex is great. Sex is awesome. I like the way that feels. And so that's what testosterone does when you're younger. It actually is involved in that brain chemistry to say this is something that's enjoyable. So it works in both arenas for women, but it's not the only thing. There are medications like Addyi and Vyleesi, both of which can be written by prescription, which are also approved for hypoactive sexual desire disorder, which is low libido. And then there's also some great supplement herb options. Like, I love maca. Maca is fantastic for improving libido, for improving sexual health and wellness. There's actually creams that can be placed on the clitoris. That's called Scream Cream that can be compounded. And there are other things like oxytocin trokes that are helpful. So there are a lot of different options for improving arousal and desire. Testosterone is just one of them. And I find, because there's so many other benefits for testosterone besides sex life, that a lot of women can get relief by using it. The last thing I'll just mention about it is, if you do get blood work, which you should, you want to make sure you also look at the other source of androgens to make sure testosterone is right for you. So you want to get a blood test that has DHEA, DHES, as well as the total and free testosterone. And then I often check estradiol with it, because testosterone can be converted to estradiol. So I just want to make sure people are safe and this is the right regimen for them. Back to testosterone, I think it can spice up your sex life. It can bring that arousal and desire that you may have lost as you went through perimenopause. I think it's amazing. So let me know if you have any comments.